And today, the government has confirmed one case of the coronavirus in the country. In a live press briefing this morning, the Health Cabinet Secretary Mutahi Kagwe said the patient is a Kenyan woman who arrived in the country on the 5th of March and is under treatment at the Kenyatta National Hospital. Our health reporter Eunice Omolo was at the briefing and now joins us live. Eunice, COVID-19 is officially in Kenya. What else do we know?
Thank you, Zainab. So far, Kenya becomes the first country in East Africa to report confirmed case of COVID-19 and the 15th on the continent to report the same case. And as we know, today Mutahi Kagwe, the CS, held a press conference where he broke down the details in terms of this first case that has been reported in the country. All we know for now is that this patient arrived in the country on 5th of March and the patient, lady, tested positive on 12th March of this month. And so far so good. What we know is that the patient is recuperating at the Kenyatta National Hospital, where the CS say that the patient is stable and the fever has gone down and they're managing the condition. I'd like us to listen in to what the CS had to say early in the morning.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya. The case was confirmed on the 12th, which was last night, as the first one to be reported in Kenya since the beginning of the outbreak in China. The case is a Kenya citizen who traveled back to Nairobi, returning from the United States of America via London, United Kingdom, on the 5th of March 2020. She was confirmed positive by the National Influenza Center Laboratory at the National Public Health Laboratories of the Ministry of Health. I would like to add here, however, the patient is stable. Her temperature has gone down to normal. She is behaving normally. She is eating, but she cannot be released until the tests continue, until she gets negative.
And we were listening to the CS Health, Mutahi Kagwe, giving us an update of the patient, the first case reported in Kenya. And the CS has also urged Kenyans to be vigilant, and he wants Kenyans to practice and exercise high level of hygiene as a way of trying to mitigate or prevent the spread of the disease. And so far so good. Kagwe also explained that the index patient had also indicated or listed down the number of people she had come into contact with, and the government is slowly following up. And meanwhile, the government is insisting and urging Kenyans to ensure that they're following up on little steps in terms of hygiene to ensure that they're safe. And here is what he had to tell Kenyans, the do's and the don'ts.
All Kenyans to observe the following. Number one is to regularly and thoroughly wash your hands with soap and water or use alcohol-based hand sanitizers. Maintain a distance of at least 1 meter, about 5 feet, between yourself and anyone who is coughing or sneezing. Persons with a cough or sneeze should stay at home or keep a social distance, but avoid mixing with others in a crowd. Maintain good respiratory hygiene by covering your mouth and nose while coughing and sneezing with a handkerchief, tissue, or flexed elbow. Stay at home if you feel unwell with symptoms like fever, cough, and difficulties in breathing. We have suspended all public gatherings, meetings, religious crusades, games, and all events that are of a huge public nature. No more church services can go on provided that they provide sanitizing and hand washing as people go into the worshipping areas. We have suspended all inter-school events, in other words, school-to-school athletics, school-to-school events, but the schools at this moment remain open.
Okay, so far we are listening into the CS Mutahi Kagwe on what Kenya should and should not do in this time where we've reported, the government has reported the first index patients in the country. And this gives the total in Africa to 146, and we have already reported 5 deaths in Africa so far, and we have a total of 45 recovered cases in Africa. We'll be following in on the updates on the developments in this case and across the region, and we'll be giving you more information on what is going on in terms of the COVID outbreak, COVID pandemic in the country. Sorry.